It's a hormonal condition that affects a person's parathyroid glands. We're talking about primary hyperparathyroidism. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Stacey Woodruff, an endocrine surgeon at the Queen's Medical Center. Aloha, Dr. Woodruff. Thanks for joining us this morning.
Thank you for having me.
So just to kick us off, what is hyperparathyroidism?
So primary hyperparathyroidism is a disorder of the parathyroid glands, which regulate calcium in the body. There are 4 parathyroid glands in the neck near the thyroid. And in this disorder, it's usually one of the parathyroid glands that becomes abnormal, although more than one gland can also become abnormal. In 80% of cases, it's just one gland. The rest, it's due to more than one gland. The abnormal parathyroid glands secrete too much parathyroid hormone, and this tells the bones to release calcium, and that causes the calcium in the blood to be high. So the loss of calcium from the bones can cause brittle bones or osteoporosis. And then since the blood is filtered through the kidneys, high calcium in the blood can cause kidney stones. There are actually many people who don't have any symptoms from this disorder, and it's just a finding of high calcium on routine blood work done by their primary care doctor.
Now, for viewers who may not know, how is primary hyperparathyroidism diagnosed?
So it's diagnosed usually with blood and urine tests. The common blood chemistry panels that are ordered by primary care doctors include a calcium and also a measure of kidney function. Additional labs that we would order include a parathyroid hormone level, a vitamin D level, and sometimes a 24-hour urine collection. And in primary hyperparathyroidism, we see high calcium and high parathyroid hormone. The vitamin D is usually normal, sometimes low. The kidney function is usually normal, or at least at a patient's baseline. And the 24-hour urine calcium would show normal or high urine calcium.
And with that, then what is the treatment for primary hyperparathyroidism?
That's a great question. So surgery is the only cure for primary hyperparathyroidism. And surgery should be strongly considered in anyone with this disorder and kidney stones or osteoporosis. Other reasons to consider surgery would be patients who are younger than 50, patients who have very high blood calcium, lower kidney function, or very high urine calcium. In preparation for surgery, we will do imaging tests to try to identify which one of the 4 parathyroid glands is enlarged. The imaging tests could include an ultrasound of the neck, a nuclear medicine parathyroid scan, or a parathyroid CT scan. If we're able to find an enlarged parathyroid gland, then that allows us to do a shorter, more focused operation to just remove one gland. And during surgery, the parathyroid hormone levels are checked to ensure that they come down to normal. And so that should happen within about 10 minutes of removing the enlarged gland. If this doesn't happen, then the other glands need to be assessed during surgery. Surgery is typically a same-day surgery procedure, and recovery is maybe around 1 to 2 weeks.
Wow.
And then after surgery, patients are given calcium and vitamin D supplements to prevent low calcium while the other glands are balancing the calcium level out.
Very good information. Thank you, Dr. Woodruff, for that. Well, to learn more, visit queens.org.